two of our favorite people back in the studio. So excited to have you guys both back in here and see you again. Last time you were here November 22nd, 21. So it hasn't been too long.
No. We're so glad you invited us back. Thank you.
Of course.
Yes, thank you.
And for those that haven't heard this episode with Dr. Craig Koniver and Kelly Koniver, you guys should go back. It's episode number 411. So pretty recent, but that one went on fire. Anyways, welcome back.
People
so good to be here.
Loved you guys on the first episode. And I really think it came down to the honest, raw conversation that was real and not censored.
Right.
Let's do it again.
We're going to do it again. I'm so excited. So first, tell us why you're in Austin.
To see you guys and be on this podcast.
And also
to go see our friend Whitney perform tonight.
I know.
Yeah.
So you guys have to tell us after you see her perform if she's amazing, because everyone.
Well, we've seen her twice, so she is amazing.
Come a little closer.
Yeah, we've become groupies.
That's okay though.
No, she's so witty and smart, so funny, and obviously you get a taste of that on her podcast and Instagram. But she's very talented.
You have such a cult following with celebrities and influencers, I feel like. How did that even start?
I mean, it's word of mouth. So, as you guys know, like it's not a very big circle once you get to work with some of these types of people. They all know each other.
Is there one person that has openly talked about you that you think has just spiraled everything?
Whitney's one of them, for sure.
Whitney's been the most vocal for sure.
And you also had Hannah. I don't know her last name. What's her last?
Hannah Stocking.
Just say that you're absolutely amazing and she loves peptides.
Right.
Well, I wanted to have you guys both back because when we first met, it was like right when we first started doing things together. And I've done a lot with you since then.
Yeah.
And regularly do a lot. And I wanted to talk to this audience about it because they ask inevitably, like I show doing the NAD and I've talked about peptides and we've had you on the episode, but I haven't actually had you back since I went and did everything. I mean, even all the blood work and all the tests. It's been kind of like a regiment.
It's been a routine. It's been interesting to watch dead sober, not being able to do anything.
Well,
you're the sacrificial
he's
lamb.
saunaing, he's cryotherapying, he's in his ice bath, he's peptides, NAD, and I'm sitting there.
Well, it's compensation because you can't. He's doing
it for you too.
You're living vicariously through him.
Oh, okay.
It's actually been easier to do it while you've been like this because we haven't been out running around partying.
Oh, I'm glad it's been so easy for you. It's smooth sailing.
Well, normally, like if we're out and she's not carrying a baby, we're out hitting the town like you guys, So, the wheels are kind of falling off. So I'm like, this is the period.
We do hit the town hard, yeah.
So I would love for you, Dr. Craig, to explain peptides in depth to our audience. We've had so many questions on it. And then Kelly, I know you're a fan, so I would like to know how you've responded to it as a woman.
Okay.
Yeah, so elementary level peptides are just chains of amino acids. Amino acids are like the building blocks of life. So people are familiar with them in terms of building solid structures in the bones, ligaments, tendons. They make neurotransmitters. And then in the body, there's thousands of peptides. So we call it a peptide if it's less than 40 amino acids in length, and we call it a protein if it's greater than 40 amino acids. These are, by definition, small molecules, and there's so many of them, and they're so safe. So they're just like little messengers. So just think of them like little messengers. We inject them primarily into the body, and then we want them to do certain things, which they just know what to do because of just, the functional biochemistry of that.
I think people get confused. Like they think like growth hormone.
Yeah.
And when we talked originally, and tell me if I'm wrong, you said growth hormone, you can artificially maybe inject too much.
Yeah. So growth hormone, anabolic hormone helping with growth, healing, rejuvenation, repair. And there's a host of growth hormone releasing peptides that are going to be safer for the most part than growth hormone because they're just going to help you push out more growth hormone. So if we use that as an example, if you're using a growth hormone releasing peptide, the most popular one is probably something called ipamorelin. You inject it, it travels up to the pituitary part of your brain and tells you to put out growth hormone. So it binds that receptor and says, put out growth hormone. So it's giving your growth hormone a push.
But it can't create more than your body's able to naturally produce.
Correct. And but the thing, a caveat, I guess, is you just want to stay within, a good dosing regimen. Because I've heard of, even since we were here, there's pharmacies and doctors prescribing, in my opinion, too much of these peptides. So people are getting a big dose thinking, okay, I'm going to really wow the client. I think you just have to be careful.
That's interesting that you said that, because one of my friends who did not go to you went to what you're saying. He took peptides and all of a sudden he was waking up in the middle of the night sweating. Is that, was he overprescribed?
Potentially. I mean, I don't know, but maybe.
Okay.
I think there's, what I see is, a lot of doctors, providers are getting into the peptide space because they're so safe, they work so well, but they don't really know how to use them. So they're just like, oh, I want to wow the patient. I want to wow the client, make sure they feel it. And that's common with really most things in this space. People are like, I need to get an effect so that they keep coming back for it.
Do you notice that the clientele for peptides is either lazy and doesn't want to do the work and thinks the peptide's going to fix it, or is it hyper overachiever that wants to be the best version of themselves and wants to take it to the next level?
The latter. I mean, the vast majority of our patients are the high achievers in the world, right? They want to do stuff. They want to have an edge, feel their best, perform their best.
So what if someone came to you and they're like, my skin is breaking out, I'm 20 pounds overweight, I feel tired, I have no energy, and I have anxiety?
Yeah. So I don't think peptides alone are going to do it, right? So, but I think peptides can be a bridge to then motivate people. So the analogy I use, for better or for worse, we're used to, or at least I'm used to, telling people, here's how you're going to train for the race, right? You're going to get your nutrition in line, you're going to work out, you're going to sleep better, and then eventually you're going to run that race and you're going to see what that feels like. Peptides like NAD, they help people win the race first. And then by seeing that and feeling that, people then buy in to wanting to do the training. So it's like reverse.
That makes sense. So it's almost like a tool in your toolbox.
It's a big tool.
It's like a hammer? What are we talking about? A nail?
It's more of a hammer.
It's a hammer.
Yeah.
Okay.
Well, I'll tell you about my Kelly, and then maybe you could tell me yours, because I've done 2 rounds of the peptides. Well, no, maybe more. Yeah, right. No, 2 types of peptides.
Right.
Once. I did the strength one to start back last year towards like October, November. I mean, what's interesting is you told me that I would take them and I would start to feel like really hungry. I never got that. So I didn't really feel, but I definitely got stronger. I didn't get much bigger, but I got stronger. And then later when I was having my eye issue, I was like, hey, maybe I'm having some neurological things. And I did the one tell me if it's like the mind one.
Yeah, the neuro regen.
Yeah, and that one I noticed. Yeah. That one I noticed a lot. I was like lights on point, very sharp, very quick, like sleeping.
And it happened quickly because you texted me after a few weeks. You're like, this is really cool. Yeah.
Yeah, exactly. And I wonder if you could like maybe get a little granular on the types of peptides and why people seek them out.
There's lots of different ones. We talked about growth hormone. I call those the fitness peptides, right? Because growth hormone helps people be stronger, fitter, faster. There's peptides for inflammation, peptides for the immune system, peptides for your nervous system, peptides for the mitochondria, peptides for skin, all kinds of different classes of peptides. And so what we do is we combine them together in novel combinations, and then we want them to work synergistically. Just like people stack supplements, a lot of people are familiar with, I'm going to stack these supplements. So 1 + 1 doesn't equal 2. 1 + 1 now equals 4, because they work better together. And that's how peptides work too. And just, they're so safe that we can keep stacking them in novel combinations and a lot of trial and error and figure things out. But they're so safe that people can try them safely.
And Kelly, what has been your experience personally with peptides? It'd be so cool to be married to him and have access to all these different potions.
It is cool being married to him and having access. To be clear, I've done both the human growth hormone and peptides, so I can give you the perspective on both.
Yeah, give us both.
So human growth hormone is ridiculous. I mean, it's an unbelievable feeling, but it's not something that you can do from now on. Particularly at my age, I'm 42, so I don't want to shut down, and I'm not a physician, let me be clear, but I don't want to shut down my body's own ability to produce growth hormone. So the reason I love the peptides is, first and foremost, the thing we always ask is, are they safe? And they're super safe. I started with the Glow when he first started offering them. I guess that's been, 2 years ago?
That's the one Whitney posted about?
Correct.
She's done Glow,
yeah.
And my skin literally just lit up within a couple of weeks. So really love that one. I've done the fat loss.
Fat loss.
Yes. Can't say I noticed a ton from the fat loss, though it is our best seller.
Because you don't need to lose fat.
And I don't eat correctly. And then I have recently tried, I lost 50% of my hair with COVID, and I've done Revive. I can't keep the name straight. Revive?
You mean post-COVID, like after
Correct.
COVID?
I had telogen effluvium post-COVID hair loss. Lost 50% of my hair.
Wow.
As in literally coming out in chunks. If you didn't know I didn't have cancer, you would have thought I possibly did. It was
that's scary.
Tragic.
It was scary.
Yeah, very scary.
You did the remedy one.
Remedy.
Yep.
Is that what happened to you, Dr. Koniver?
50%
since I was 20. I had COVID,
So scary.
I had COVID 27 years ago. Yeah.
I've since done a ton, which has thickened it back up. In fact, what I did was a cell with platelet-rich fibrin. He injected it all in my scalp. That was quite a day. It was the most painful thing ever.
You got to tell us what that is.
So platelet-rich fibrin, he draws my blood, spins it down, and puts it in a centrifuge. All of the growth factor, stem cells, all of that rises to the top. He takes it, he mixes it with this product called A-cell.
Which is a placental matrix.
Yeah, like a membrane. And so he puts that all in the scalp.
Inject it.
It was so
like 100
painful.
injections.
Wow.
It's the most painful experience of my life. I've done a lot.
Wow.
Yeah.
It was rough. But my hair literally started growing like a chia pet within a few weeks.
So here's my question. If there's a guy out there struggling with hair loss or like a cul-de-sac situation, could they get that done over hair replacement?
For sure.
What's the hair replacement thing called?
Hair plugs or
hair plugs?
No, it kind of depends. So if you're true balding, like it would do nothing for him. If you're starting to experience like the early signs of hair loss, like you're just starting to notice a little, that's when it works great. But you have to start early.
But to interject, so a lot of guys start losing hair, having thinning hair because they're on testosterone replacement, for example. And so it would probably help them, right? The trouble is not enough people have done this to really qualify. What's nice about it's so safe. If you can withstand the pain, like it's no harm, no foul. So you're not going to get worse, and likely you'll get better because you're going to stimulate those hair follicles in ways.
Can I go in and get my hair stimulated?
Totally.
But how do I get like a morphine or something?
We have Pronox, which is nitrous oxide.
Yeah, why don't you want to do that?
Oh, I did.
There's Feel Free.
I did that. There's plenty of tools, Lauren, when you're ready.
Natural.
Interestingly enough, you know, my friend Gunter, who owns Kuya here.
Yes.
So we saw him for dinner 2 nights ago. And when he came to town.
He was in town. He came to Charleston in January.
And we did it on him. And literally I said, oh, so how's your hair? He said, oh my God, that stuff is amazing.
Yeah.
I want to do it.
It's universal.
This is what I want to do. I want to go to Charleston and I want you guys to
go
put
down there for a month.
To put me through a car wash. You know how a car wash pulls and yanks and rubs and tugs? Like, just put me through the car wash, the Koniver car wash with skin and just do it all. If I could be under nitrous oxide, that'd be great. And then we'll just show the audience the whole journey.
That's
Make me the guinea pig.
We got a lot of guinea pigs.
Perfect.
Jump to NAD, which I definitely want to do because I got so many questions about that. Inevitably, I want to try to answer. I know how the listeners. So this is a shot that you're taking with these peptides.
Correct.
Some people may say, is this a steroid or like a steroid? Because people think it's this kind of steroids. And maybe just clearing up that.
That's a good question. No, it has nothing to do with steroids. So it's not an anabolic steroid. It has nothing to do. It's not hormonal at all. It is injected into the subcutaneous tissue, which is right under the skin. Again,
you don't notice them.
Yeah, really, really very small needles. So it's not going to be painful. It's not going to work for everyone, but it's certainly going to be safe. So it's worth trying.
2 questions. If someone is having fertility issues, is there a peptide for that?
Yeah, I mean, what we've seen with fertility, actually NAD works well. And then growth hormone itself, or using growth hormone releasing peptides, helps to, again, get those cells in the best, environment, which will help with fertility.
So would you tell someone to start with with peptides before they jump to growth hormone, or is it case by case?
Yeah, I mean, there are circumstances. I think growth hormone is really appropriate. Someone's injured themselves after a surgery. You can use growth hormone for a month to 2 months to kind of snap back really quickly.
What are these things that I hear in Hollywood with like the supermodel Naomi Campbell, like using growth hormones?
They all do.
All the time.
Yeah.
Is that bad for you?
It's not bad if you use it, in my opinion, within, a certain framework. So if you're using therapeutic, replacement doses, I don't think it's bad as long as you're being monitored. What tends to happen with growth hormone is that young, healthy people use it and then they get outside of that because if a little is good, they think a lot is better. And that's not necessarily true with growth hormone.
So if let's just say I'm not pregnant and I take growth hormone, what's it going to do? Does it make you look younger? I don't understand.
Yeah. A lot of people, they'll get fit. They'll lean out, they'll sleep really well, helps your skin. It just helps every cell in your body kind of be its best. So it is kind of an anti-aging hormone.
But is it true that it grows cancers that are in your body?
I don't, again, if you're using a replacement dose, I don't think that's true, right? I think because if it's what you would be making anyway. So that doesn't make much sense to me. But that's what people are afraid of, is like, if I use growth hormone and I have an underlying cancer, I'm going to grow it and then I'll be in trouble.
So is the common mistake people make is they use too much and they're not doing this with a physician?
Yeah, or with a physician who knows how to do it.
It's like too much of a good thing.
Right.
It can be. So I've had these young, healthy guys who are in their 20s who don't need growth hormone, who are using it because they'll wake up, do a hard workout, not be sore at all, and do that over and over. That's growth hormone. They love it. And they get super strong, super fit, super fast. And they're like,
It's
let's
amazing.
keep going.
Okay, but here's my question. I always think about this. What happens when they stop?
Yeah. So when they stop, then things go a little bit awry.
That's why I'm always thinking about that with all these quick fixes. What happens when you stop it?
Yeah. Then you have to do some work to kind of get your system regulated again.
Do you gain a bunch of weight though? Because your
It just depends.
Yeah.
So I did it because I had a back injury.
Right.
I was a competitive gymnast growing up, herniated L4, L5, S1, and just struggled with low back pain. So he said, well, let's try it. I did it. Boom. The pain completely gone. Completely gone.
And that was years ago.
That's been years ago.
Hasn't returned.
But the things I did notice, you sleep well, like really well. You can work out your hardest workout you've ever done. And I mean, at 42, you feel it the next day. You don't feel anything. It can be addictive. So you wanted to know what happens is it's just like anything, whether it's a drink or a drug or whatever. If a little bit is good to people, they assume a lot's better.
Not with growth
So
hormone.
what did you do? Did you stop it? Did you keep going?
Yeah, well, so here's why I stopped. Well, I stopped at part one because when I started it, I knew that I was only doing a couple months and would stop. I mean, he monitors me. The other thing is, unlike everyone else, like all of these celebrities whose skin glows, my skin did look amazing on it, but everyone else leans out and loses weight. I did not.
Yeah, some people, there's a fluid shift and they can get
You're
a little
also
puffy.
thin to begin with.
I felt puffy, like
and
I'm
that
stuffed
happens.
in these jeans. I was really stuffed in my jeans then.
You said something interesting that I want to go back to before we jump to NAD. You said people or men who are on testosterone replacement usually start balding.
Well, they can.
Why are so many men on testosterone replacement, and what are the repercussions of that, and what are the benefits?
So, I mean, testosterone is probably the most important male hormone.
Okay.
But for most men, as they hit their 30s and 40s, you stop making it as much. And if you stop making it, you just can't feel as good. You can't do it.
Their sex drive goes down and the woman's sex drive goes up.
Potentially.
And so with lower testosterone, when you replace it, you get hair loss?
You can, because of how the testosterone is metabolized into another hormone called dihydrotestosterone, which affects the hair follicles. And then, there's always downstream effects, right? Nothing works in isolation.
When I gave birth, afterwards I went to a hormone doctor and she was recommending progesterone. What do you think about that?
So progesterone is the first female hormone to decline, right? And so progesterone is, people think of progesterone as the most important hormone actually in pregnancy because it prepares the uterine lining for the pregnancy, prepares the uterus. But you have progesterone receptors in your brain, your thyroid. You need progesterone throughout your entire life. It helps balance estrogen. It's anti-inflammatory. It's calming. It's grounding. I think it's the most important female hormone.
So would you recommend replacing it if you're low on it?
Then we do that all the time.
Okay, but there's two ways to do it. There's this one where you put this cream on your vagina.
That's one way to do it.
And then there's another where you do the pellet under your mouth, right?
Or you can take a capsule.
Or you can take a capsule.
Or you can put cream on your wrist. Or you can do a drop under your tongue.
So there's different ways.
Lots.
And do you see any downsides of people using progesterone?
Again, it's about balance. So some people, most women do very well with it if it's used appropriately and dosed appropriately. And some women it doesn't do much for.
Okay.
So it's like anything. There's an individual component to it. But in general, as humans, our hormones decline as we age, right? And so for women, that's going to be progesterone and thyroid. Those stand out.
That's what happened to me, the thyroid.
Yeah, and that's most women. Same thing with Kelly. Most women will have to deal with a thyroid issue as they get older.
Why?
We don't totally know yet. But it's become an epidemic in the last 5 years. Like it's across the board. Most women, just like with men, low testosterone, they're going to need some testosterone replacement if they want to do their best, feel their best, perform their best. And you can do it so safely and have the best life. Or you can say, I have some patients who are like, I don't want to do anything because number one, don't rely on it, and two, no, it's not natural. And it's like, well, it's not natural to age quickly either, but it's there's lots of options.
I was so puffy and tired and lethargic after I gave birth, and I went to this hormone doctor, and she was like, you have hypothyroid.
Yeah.
And I got it balanced out, and I lost 20 pounds in a month.
Yeah.
Like it fell off me. And then not only that, I used to want to nap in the middle of the day. I have not napped
Kelly. Yeah.
Same.
once since I've been balanced my thyroid.
Yeah, it's
not
a big deal.
Once. I don't need to nap. I'm like fine.
Yeah.
So
huge deal.
It's like if you're out there and you're listening and you haven't gotten your thyroid checked and you're tired and you can't. She told me that I could have worked out 20 times a week and barely eaten, and it still was working against me. It was wild.
So it feels like you're walking in quicksand.
It was
brain fog, feeling cold, constipated, dry skin.
Yep. The thyroid is a serious thing, huh?
For women. Most men won't ever have to deal with it.
Do you think it's bad to be on thyroid medicine?
No, I think it's totally safe. Again, done well. If without it, you can't have a great life.
Okay.
And once you start, you have to stay on forever.
For the most
you would
part,
not be happy if you stopped.
Yeah.
Really?
You couldn't. Yeah.
But again, I think people have this notion like, I don't want to depend, I don't want to take stuff. Like we all take stuff, right? Like that's okay. Like we live in a toxic world, not trying to be negative, but we live in a very stressful world, right? And we're trying to get a lot of stuff done. We're trying to perform our best. That's challenging over time.
Well, yeah, it's stressful when Michael says that I can't eat in bed at 7 o'clock after I've done
More
4 hours.
Cleanliness issue.
I want to eat in bed with my bed tray last night, and he was telling me I can't eat in bed.
I don't think he said he can't.
Yeah, he said I
came in with a hat, and I said, you can't work with it.
He goes, you should sit up at the table. And I
then
said,
you woke up.
When you're 7.5 months pregnant, no.
I came in dressed as Napoleon Bonaparte.
I wish guys could carry like 40 pounds of weight in their ball sack. And then I would tell him, why don't you sit up at the bar stool?
Now, Michael's doing the cryo and sauna. He's got that he has to deal with in the test.
Last night,
the peptides, the NAD.
The last I will say about the peptides is when I did it for 2 months and then I stopped. Like you told me, like, okay, you might have. I didn't notice any decline. I was more like, okay, now I need to maintain what I gained.
Right.
So it wasn't like you asked earlier, like, what happens if you stop?
Right.
You are unique, though, and I'll tell you why. You have great genetics. You never gain weight. You will work out once and swell right up. Well, yes.
Okay. He also doesn't eat in the bed.
He doesn't eat in the bed, and
he
doesn't. He's not attached to food. There's no attachment. So like. I'll be like, oh my God, chips and salsa sounds so good with a margarita right now. And I've never heard him say that.
I don't want to lie to people. I mean, listen, there is a genetic factor that I'm fortunate in. And I've worked out my entire life. But I take, like to your point, I take a pharmacy of supplements every day.
He's disciplined.
Not always.
Yeah. But he's also,
for the last 8 months for sure.
But he also, I think what it comes down to, not joking aside, like he's got a great approach. He's got a great attitude, right? And attitude is everything.
He's also a fourth Japanese.
We're going to talk about, and we're going to talk about. I did this blood work, and so he knows everything. He knows he's seen everything now under the
curtain.
I want to talk about NAD because I've done it now. When did I start doing it?
You've done it probably 9 treatments, I would imagine.
Yeah, I did the loading dose, and then I did.
You've done 4 or 5 since then, I think.
Yeah, and I love it. Can you explain it a little bit more? Can you just
sure
again? People don't know what it is.
Yeah, no, I get it. I get this question a lot. NAD is a vitamin B3 derivative, so it's a chemical cousin to niacin. It's the stuff our mitochondria, which is the battery of the cell, uses. It's the rate limiting stuff our mitochondria uses to make energy, chemical energy called ATP. So what we know from lots of research being done is that as we get older, stress out our bodies, different genetics, we use up our NAD pool, and therefore we can't do as much. We don't have as much energy. So we give NAD back intravenously or through peptide injections because it's way better than doing it orally. And people have transformational results. They feel better, it hits their nervous system, their mood is better, handle stress better, all these things. Very safe. Again, another therapy that's so safe. It's gaining in popularity, although we still don't know a lot about it. We're fortunate. We've worked with NAD longer than most. So I think we've overseen more NAD treatments than anywhere else in the world. So it's really become our thing. And people say, well, why are you so in favor of NAD? because we've seen the results, like on thousands and thousands of patients.
So anyone in the world could contact you right now, like via Instagram, and you can prescribe NAD to them?
It depends. I mean, we have people.
Whoa.
Yeah. I don't know about anyone
that
in the
implies
world.
he checks Instagram first, Lauren.
Yeah, that's right. But yeah, I mean, we have different things set up. We have people come to our office in Charleston. We just opened a few clinics with Soho House in London. So we're there in England now. We're going to be expanding there. We try to oversee a lot of treatments that get people access to it.
So let's say this. I mean, obviously you only have so much time. Maybe somebody's your patient, maybe not, but somebody's looking to do NAD treatments. Where's the best place to start, and what should they look for? What should they avoid?
That's a good question. I think for us, we're very particular about how we do it. We do a certain dosing and a certain, like you did. We want to do 5 treatments in 10 days or so as a loading dose. For the loading dose. We found that you have to do a loading dose, catch people up to get started.
For the very first time they ever do. That's what
that's most people respond to that. And we came up with that from testing it. We just observed how people did over time doing it in a certain way. So there's lots of different NAD products. We like the ones, we have one that's made specifically for us and the doctors we work with that we think is the highest quality. So there's quality issues. There's how do you do it? And we do actually, we train physicians and practices on our protocols because again, we're interested in spreading it. Yeah.
But with the rise of this, I see more and more people doing it and more clinics opening it. Is there things that are questions they should ask before they decide to move forward?
I think they would want to ask, what is the dose they use? What kind of NAD do they use? Meaning like we have a lyophilized powder, which is very stable. A lot of clinics don't. They use a liquid that's frozen or not, I think, but the dosing is big. Do they do a loading dose? And then cost is a big thing. NAD is expensive. There's a lot of price gouging going on. So a lot of doctors and practices are charging way more than I know they need to, which is fine, all about people making a profit, but it's getting a little bit out of control.
What's a good price?
So at our office, we charge $550 per treatment.
Okay. And Kelly, you told me that out of all the things that you've tried, and you said you've tried a lot, that NAD, you noticed the biggest difference.
The very best. It's the most transformational.
What did you feel?
Everything. Focus, clarity, you sleep better. It's one of those things, and I'm asked this a lot as well. I can't tell you one specific definitive thing. I can just tell you when I don't use it, I absolutely know.
Yeah, I would say the same thing. What I noticed, that loading dose was crazy because I'd never had it. And then all of a sudden you're doing 5 of them in a 10-day period.
Right.
And that's intense.
Super intense.
But now I just do it once a month.
Yep.
And every time I do it, I notice, like you said, more clarity, more focus, better memory. Memory recall is crazy. Like I had to go give a board presentation to my board and I didn't even need to look at the presentation. I could remember every single number and thing on there. No real anxiety. Stress is extremely easy to manage. I don't have any depression. I mean, I'm listing a lot of crazy things here. Energy, focus. When I work out, I have really good recovery. So
you want to know what I noticed?
What?
That your nails are out of control.
Like
okay, I have known Michael since Michael was 12 years old. I know what his nails look like inside and out. I could draw them. I could visualize nails. Them. No.
Yeah.
Your nails are like goddamn acrylics now. It's like a French manicure acrylic. I have to tell him, go cut those things with like pliers away from
like every 3 days though.
And what is going on? His nails are so long.
That's amazing.
But I
don't even want to look at your toenails.
It's one of those crazy things where it's like it's one of those crazy things where there's so many, in my experience, like it's like almost like a miracle thing. You're like listing all these great things. You're like, okay, like I know there's listeners that are being skeptical here, but it is, of all the things I've done, it is it's the craziest.
Don't scratch me in bed.
Yeah. I mean, it doesn't work for nothing works for everyone. So I don't want people to think like, oh, it's a silver bullet because it doesn't exist. But if there's one thing that people can do, well, let me say it this way. If there's one thing people want, in my experience, is more energy. Like everyone wants more energy. You can't ever, just like you can't be too strong, you can't have too much energy. So it's helping in that regard. So even if people get a 10% bump in energy, that's a huge win.
What are some things that you think are really avant-garde that are up and coming, things that not a lot of people notice for fat loss, energy, and strength?
So one thing that'll become popular, there's been podcasts about this, but methylene blue, that people are talking
blue
about.
Stuff that's on your tongue.
Yeah, that's one way to do it. We do it intravenously as well. But methylene blue is the substance it's used traditionally for different reasons, but one of the things it's used for is if people have carbon dioxide poisoning, they give people methylene blue and it helps put oxygen back in the cells and helps save people's lives that way. But it also works on the mitochondria, different parts of that mitochondria than NAD. So you can pair methylene blue with NAD, and now you're making your mitochondria supercharged. And that's what we're going to hear talked about a lot in the next year or two.
What are other things that you think are really up and coming, if any?
That's one. And then different peptides for sure. There's a lot of different. We're using another neat peptide called cerebrolysin, which has been around for a while, but people just haven't used it this way to help people. Kind of helps that nervous system kind of make sense in a meaningful way. And so you combine that with NAD, and now you've got a nervous system that's communicating faster, more efficiently. And so it's just these different tools that are very safe that we can do to really thrive and push people in a way they haven't been, like super fast getting people working.
What about on skincare?
Oh my gosh. Our industry is just constantly evolving and changing. There's so many new products coming to market. I actually brought you guys the Upneek, which is a smooth muscle relaxer. It opens the eyes. They're calling it a bluff in the box.
Wait, explain it opens the eyes.
Yeah, so it's a smooth muscle relaxer. I'm going to butcher the name. It's oxymetazoline. Am I saying that correctly?
I think oxymetazoline.
Okay, gotcha.
Something like that.
Oxymetazoline hydrochloride.
Yeah, so it also has a whitening effect to it. It's not as good as Lumify in that regard, but essentially you put 1 drop in each eye, blink a few times, do 1 drop in each eye again. It's 1 individual dose. You toss it. Don't try and save it because it's preservative free. You wait about 15 to 30 minutes and your eyes literally open. Incredible.
I'm going to be like a lemur over here.
You're going to be like
it's
Zaza.
Awesome.
Zaza does not need that.
She does not need that.
Zaza does not need that.
Yeah,
I
but
do.
she just has amazing eyes. But most women over the age of 40 have some degree of acquired ptosis, whether they realize it or not. So if you think of ptosis, like if someone gets bad Botox and then their eyes start to droop, that's what a lot of this stuff was designed to treat. And now they're coming out with alternative uses for it.
I have seen that a lot in women from the ages of like 45 to 55. I've seen the eyes start to droop from too much Botox.
Sure.
That's interesting. So that's why they created it in the first place.
I don't know that that's why they created it, but that particular drug has been out in another formula in the past. Upneek is just the latest on the market.
It's so interesting because with Botox and filler, it's the same as you were saying about growth hormone. Growth hormone, if you go overboard, it sounds like it works against you. And I'm noticing as I watch all these procedures done and Instagram and whatever, that if you go overboard on Botox and filler, you look older.
Of course. So you ask some new things in our field. I think you're going to see more and more of Sculptra. So Sculptra, it's poly-L-lactic acid. It's the exact same stuff that absorbable sutures are made out of. You place it deep in the dermis. Your body recognizes it as an injury, grows collagen and elastin around it. So we liken it to Miracle Grow for the skin. It actually came out decades ago in the 70s to treat HIV patients that got really gaunt and thin. They've rediscovered its use in aesthetics. It's going to explode in coming years. So many devices are new.
What are some aesthetics that you always go for? Like for me, one of mine is like, I think microneedling is absolutely amazing.
For sure. So we have 2 combo treatments in the office. We have radiofrequency microneedling, and we combine that with a treatment called Cool Peel. And Cool Peel is actually, it's used as CO2 laser, and they've dialed the thermal energy down in it. So therefore you dial back the downtime, and I do those 2 together. So RF microneedling immediately followed by the laser. It's amazing.
Wow.
And then you can get a Skinny Confidential ice roller to in your office afterwards so you can cool down with it.
So ironically, it's funny you say that. So we just bought a new 585 Denave laser, which treats redness. And part of the protocol is you want to ice the skin before and ice it after. So we just gave out a ton of Skinny Confidential ice rollers when people purchased the package of the Denave.
Amazing.
And they love them.
You know what I really want to talk about that we've never talked about on this show, and I feel like you're the perfect person to ask? Insulin resistance.
Okay.
A lot of women are having insulin resistance and don't know it. And then I was told after I gave birth that I had that too. And they wanted to put me on metformin, but I took it once and there was something in my intuition that told me don't ever take this again. I don't know what it was.
You spent all day on the toilet?
No, nothing, no side effects, nothing. There was just something about it that felt really pharmaceutical to me.
I think overall metformin's a good medicine.
You like it?
I don't prescribe it a lot. I mean, I have different opinions, which we can go over, but I think as a whole, I mean, it's used widely for type 2 diabetes.
But then why am I taking something for type 2 diabetes?
Because type 2 diabetes is based on insulin resistance.
Okay,
Same thing with polycystic ovarian syndrome. It has to do with inappropriate insulin action, if you will. So this is very basic, but if this just helps me understand, if you think of glucose or sugar as being toxic to the blood vessel,
okay,
this is just one way to think about it. And we know that it is because what diabetics suffer from is that toxicity of glucose to their blood vessels over time. So they get eye disease, kidney disease, heart disease, nerve damage, all having to do from damaged blood vessels. And that has to do with too much glucose or sugar in the blood vessel. So when the body senses that you have glucose there, you call for insulin. Insulin's a hormone secreted. It's actually a peptide hormone secreted by the pancreas, and it's secreted into the body. So it opens the door so the glucose can get out of the blood vessel and go into the cell or the muscle. And so when it works fine, it works great and people don't have issues and you can dispose of glucose or sugar fine. There's lots of reasons why that would get disrupted, and then you dysregulate that insulin, and they call it insulin sensitivity, where you're basically putting, or insulin resistance, you're putting out too much insulin and your body stops recognizing it. So you don't know what to do with that insulin, right? And so you have a hard time disposing of the glucose, but worse than that, the insulin does some negative things because you can't dispose of the insulin either because you have too much secreted. And so that makes people gain weight, right? In the case of polycystic ovarian syndrome, it makes the ovaries, secreting more than one egg at a time. And then what happens when it's actually the reverse in men, but in women, you start turning your estrogen into testosterone. That's why women get facial hair. They don't, ovulate regularly. They stop having menstrual periods. They start to gain weight. But the core of that it goes back to insulin.
So if someone has insulin resistance, is the only thing to do metformin?
No. So metformin would be a pharmaceutical way to help to get that insulin sensitivity back.
If I don't want to be on pharmaceuticals every day. Right. What would I do?
The easiest way and the hardest way for people is proper nutrition and exercise, right? It doesn't require a pill. It's just eating clean. And then probably more than that is exercising consistently. But a lot of people have a hard time with that. They don't want to do the work.
I was exercising consistently. And I mean, I definitely love a piece of sourdough toast in bed. But I mean, would you just cut carbs completely?
If you cut carbs, it's the fastest way to kind of get things back.
Okay.
Now, so that's not going to work in the long term.
Right.
Especially women need carbs. And everyone needs some carbs, right? And that becomes controversial. What's the best diet? Everyone has to figure that out. But the fastest way to get insulin resistance back or away from insulin resistance to cut carbs out, because then you don't call for so much insulin.
That makes sense.
And it just kind of resets your system.
This is like I'm on your doctor's table and you have your doctor's kit and you're just giving me a doctor's appointment on air. I love it.
Okay. Good.
It does make your stomach really upset, though. So if you had a not so great experience initially.
No, it didn't do anything to my stomach. I just tried it one day.
Well, I'm curious if you did it a little longer because it makes
it's hard to take.
Yeah, it's
and
rough.
Then, I mean, there's other things like metformin decreases your VO2 max, so decreases your aerobic capacity. Mm-hmm. So people are interested in really working out. It kind of blunts some of those effects of exercise.
Yeah.
I think there's better things, and I tell people NAD, for example, is a great safety net for the mitochondria, more broad for how the mitochondria operates. So I think that's a better choice than metformin.
After I give birth, when can I come to you to get all my blood done? Because it's sauna and ice bath.
I want to talk about that in 1 second, but before, last thing on the NAD.
Yeah.
For people that are, people read articles and they say, okay, NAD can have some negative effects. And when I called you about this, can you talk about some of those negative effects or either address them or dissuade them or?
Negative is, so people are, it's uncomfortable, right? That's one aspect of it.
Why is that? By the way, I forgot to mention that. Yeah, it is. I mean, it's
rough.
Rough.
Yeah, so everyone gets some degree of stomach cramping, chest pressure, leg heaviness, sinus congestion. You feel overwhelmed, particularly that first treatment. We don't know 100% why that happens. I postulate one of the reasons is when we give people NAD, we stimulate something called mitochondrial fission, which is the cleanup or repair of damaged mitochondrial DNA. It's a negative energetic process. We think that's part of it. What we observe is the people who feel it more need it more. So if you have a young person who's fit in their 20s, they don't get much discomfort. Take someone who's 55, 60, they will get a lot of discomfort. And then you have people in between. And you'll always have some degree of discomfort, although psychologically you get used to it. And where a lot of practices fail is they're afraid of kind of pushing people through that. And so they back off, and it takes people 4 to 6 to 8 hours to do a treatment. Well, that becomes cumbersome.
I couldn't do that long. Yeah, the fastest I ever did it was 33. The longest was like an hour and 15.
Yeah.
But I'll tell you that 33 was tough. But
rough.
I kind of knew.
You were okay.
I did it like sometimes at 9 times. So I knew that last night. I was like, okay, I know what this feels like.
Correct.
But if you just went into that and never did it before, it's
a
rough.
lot. It's a lot. And so, but you only feel that during the infusion. Once we turn it off, you don't feel anything. Yeah.
Okay.
You've got to turbocharge your NAD results with the methylene blue.
Okay.
It's unbelievable. You do that first, and then you end with the NAD. I've only done it 3 times, but you've got to try it.
You've been holding out on me over there?
It's insane. It's
bit.
really good.
Like he needs more energy.
So
he will have more.
Let's talk about testing, because we just did, and I shared this, I put it on my social, all these blood results, hormone results, blood count. And the biggest question I got was, how do you get these tests, and what should you test for, and where? At least the people that messaged me, most of the physicians that they're testing with maybe aren't giving as in-depth of a panel.
Right.
We went through a lot of stuff, and then I just, just did a show. I did this gut stuff too, but it was an in-depth panel.
So there's a million different lab tests you can order. What I've decided that I think is the most valuable is hormones. So we're going to check all the hormones. We don't want to just check 1 or 2. We want to check them all. We want to check nutrients, kind of see, okay, are the foods you're eating, the supplements you're taking working? If not, how can we fill in those gaps? We want to check metabolic markers, things like insulin, blood glucose, inflammatory markers, get a sense how inflamed people are, and then some miscellaneous things. So it ends up being, we check your liver and kidney function, your blood count. So it ends up being comprehensive. People ask me all the time, why don't other doctors do this? I don't have a good answer besides.
Can they ask them to do it, or do they have to go somewhere special? Or is there?
I mean, it's like anything. If the doctor isn't really familiar with it, it's probably not going to be a good fit.
Also, I notice that a lot of doctors who aren't you will check the bed, but they don't check under the bed. So for instance, they'll test your thyroid, but they won't test like, I'm going to flub this, but like T3, T, all the different T's. So your thyroid looks normal over here and bright and shiny, but they're not testing the other stuff. So you still can't figure out why the fuck you're so fatigued.
Well, the ranges are important too, right? Because you might pass a normal range, but
I think it comes down to a couple factors. Most doctors, again, and probably most doctors would agree with this, they practice the pharmaceutical model, right? They're most interested they're listening to patient talk and prescribing medicine. They're not really there to help people figure it out because they don't really believe in it. Not good or bad. That's just where they come from. And then they're not used to looking at these, like you said, these different variables as ranges. They look at it either black or white. Like you either have this or you don't, whereas life is gray, right? And we're looking to help people optimize. And so we think there's certain ranges you want to, and when I tell people, which makes sense, is if those ranges are defined by what's in the population, well, the majority of adults in our population are tired, depressed, overweight, and taking more than one pharmaceutical. Just being in that range isn't necessarily good.
You don't necessarily want to be in the average.
No.
I don't think so.
Yeah. No, I agree with that.
I mean,
so let me
I don't
ask
want to be
you
mediocre.
This. From all the things that you see, what are like maybe the top 2 or 3 things that people are deficient in, and that they're, people are just going through life and like, hey, this is, a pandemic of itself, or this deficiency exists.
So certain nutrients, obviously everyone talks about vitamin D, but that's one of them. Other fat soluble vitamins like vitamin A is super important. Vitamin E, vitamin K2, CoQ10, we check for all that. A lot of people are deficient in those. Hormones are a big deal. I mean, it's very hard to maintain optimal hormone, kind of regulation as you get older without providing those hormones from the outside. It almost becomes impossible. And so a lot of how people feel, probably most how people feel, is based on where those hormone values are. And if you don't test per se, you don't really know, then you're never going to be able to address it.
So is there maybe 3 or 4 supplements that across the board, you're like, I can look at 99% of people and say, you should be on this?
Yeah, I mean,
vitamin D for sure.
Vitamin D and other fat soluble vitamins, B vitamins, I think CoQ10, And then usually something for people's adrenal glands. People have a hard time maintaining proper cortisol.
Mine was shot a little bit, right?
Yeah. And it's because we live a stressful life. We got a lot to do.
What's an adrenal gland vitamin? What is the specific name for it?
There's a bunch of them. So people are familiar with botanical herbs like adaptogenic herbs like licorice root, schisandra berry, holy basil, ashwagandha, things like that, cordyceps rhodiola. But then certain nutrients also help adrenal glandular cortex. It helps the adrenal gland be stronger.
Is there a brand?
There's lots of brands. I mean, there's Gaia brands. We have our own. There's Gaia is a big one. There's pure encapsulations. There's lots on Amazon.
Can I be on an adrenal gland support?
After you're pregnant.
Oh my God. What do you think about eating like your placenta? Because I'm going to eat mine.
I think why not?
That's what I said. Why not?
Yeah, I mean, no harm.
Yeah. I'm going to give Michael a piece later. He's not going to know. I'm going to be like, here's some steak.
I don't know what it'll do, but it certainly can't be bad for you.
Okay.
Are there supplements you see that specifically for men and specifically for women that they should, be conscious of, or maybe women have to take more of this or men have to take more of this, or is it not really like that?
I think it's more of the hormones that there's kind of a gender divide. Women, it's more thyroid producing things. Men, it's more testosterone and limiting estrogen. Yeah, but not necessarily nutrient wise.
When it comes to the skin, how do you guys work together with a client? Like, say a client comes to both of you. Is there a synergistic way that you work together? Sure. I would love to know more about that.
I do what Kelly says.
Good.
Yeah. I mean, look at her skin.
Most of the time, not always.
I mean, that would be stupid.
Literally, the unlock for every single husband on the planet is just do what the woman says. It's literally so easy.
For sure. But also, if you're talking about skin, I mean, that'd be stupid to be like, I know more than she does. I don't. That would be so stupid.
I do love skin.
Clearly.
Your skin's beautiful.
I love it.
Your skin's beautiful. So tell us how you work together if someone comes to your clinic.
Well, they usually start with one or the other, and then they wind up seeing, the other. It's natural. I think when we set it up, we were really worried about how it was going to flow well together because, his patients are predominantly driven towards performance and longevity and anti-aging as a whole, where the bulk of mine are women. 93% are women. The bulk are, and although we are seeing a lot of millennials now, but mid 30s, early 40s, they're starting to experience some of the early signs of aging. And they're not exactly worried about their health. They just want the Botox to get through, the next event. But it's really merged perfectly. I think that once they have worked with me, they feel better about how they look. Then it's like, wait a minute, I'm not sleeping. I'm tired all the time. I'm depressed. This makes no sense. Yes, I look great in the mirror, but who cares? So then they naturally get over to him and vice versa. A lot of the celebrities that you're referring to, they do start with his side, of course. And then it's almost like they're shocked that we have this other branch and they just naturally come across the hall.
I think too, what I've noticed after talking to a lot of plastic surgeons too, is people don't anymore bring this picture of like Angelina Jolie in and say, I want to look like her. Mm-hmm. People are interested in looking as the best version of themselves because they're seeing themselves on screen. Mm-hmm. So it's a shift that's changed because 10 years ago, they're like, I want to look just like her. And now they want to look like themselves, but an enhanced version is what I'm noticing. I also notice that people, at least myself, are really into prevention. Like
100%.
For me, it's not about like the wrinkle that's on my face right now. It's preventing the wrinkle from even showing up. Mm-hmm. Do you notice that?
That's why you look so great. Yes. It's so much
easier. Kelly.
You do. It's so much easier, cheaper, and more natural to prevent and maintain than to go back and correct. But it's interesting, you mentioned about the photo of Angelina Jolie. We actually try and screen for those patients because it's a very unrealistic expectation. Your goal should be to look like yourself, but healthier, more refreshed, better. You don't need to look like anyone else.
What do you do when someone comes in and you can clearly tell they have a body dysmorphia?
We try to refer them out. And I have a few names specifically I refer to. I'm kidding. We talk to them, obviously. We try and help them to understand, like, look, this is not realistic. You're actually going to look worse than when you're not going to be happy with it.
It's hard because
most doctors will do it, quite frankly.
Yeah, because some of them it's not necessarily conscious. It's not like they're like, oh, I'm aware of this. But so that subconscious, if you start talking about it, they don't necessarily, they're not ready for that conversation.
And a lot of doctors, quite frankly, will do it inappropriately because they're seeing the dollar signs. So, you've got, I'll never forget, we were in our old office. We had this girl come in. She looked to be 13 to me. I mean, she wound up being actually 16, but she came in with her father to get her lips done. I mean, there's just something so wrong with that to me. I mean, I just can't even wrap my head around it. What message you're sending, I can't even articulate.
But it's also with people who are, really overweight, right? Like if you don't have a good rapport there and your first, talking to them is, oh, you need to lose weight, they're not ready to hear it, right? I mean, and then people aren't going to be truthful. And I think that's, that's a big thing lacking. Like, I think what we're good about is we're authentic and we're going to be truthful. We're going to do it in a loving way, but I'm not serving the patients who's overweight by not being truthful and trying to help them there.
So what you're saying is a patient comes in, they're overweight. That's the main foundation of the problem. And instead of you saying, let's do these fat loss procedures, you're like, you need to lose weight first.
I think we have to address it, right? Like it has to be part of it. Like I think to ignore it, how are we helping them in the end of the day? And I think most doctors ignore it. They say, oh, you need to be on this medicine. Well, what about nutrition? Oh, that doesn't matter. Same thing with the skin. If you're not addressing it head on, but again, you have to develop that rapport and trust with the patient.
Yeah, in our conversations, it's mostly about talking through basically the exercise and shit, like the lifestyle stuff first, and then layering the other stuff on top to get better. But you have to have the foundational part first.
Or I don't know about first, but that has to be a part of it.
How long until I can come in and do all my blood results?
Probably. Well, you're gonna have the baby in 2 months.
Yeah.
Okay. Usually, I mean, the honest answer is once you've had another menstrual period.
Oh.
Because then that signals that your body's like back to like the pre-pregnancy.
You're able to do it. It's intense. It's a lot of blood.
No,
but that also makes sure kind of back. It's going to be several months.
I also feel like I can work with him though to work. Like I don't have to do a lot. Oh, you mean for the taking the blood?
Yeah.
Oh.
No,
yeah.
She's going to deliver the second baby. I'm sure she can handle that.
Yeah.
Oh no, I would rather deliver 10 babies than give blood.
Really?
Oh dear.
Oh my gosh, you should have seen poor
Really?
Oscar. He was
No, ask Oscar. He said I was the worst patient he's ever seen.
Wow.
He had to prick my finger, and it was as if he was cutting my toe off.
Yeah, it's intense. It's a whole thing.
I don't know what happened when I was little. There must have been something that happened, but the blood thing, I would rather give birth. I swear to God, I'd rather give birth 20 times than get my blood taken.
Wow.
I have one more question for both of you. You see so many patients, and I would say for both your cases, you're seeing high performers, people that are already kind of got on the path of wellness. Is there common things you see, whether skin conditions or health conditions, that you're seeing more and more, even with people that are performing at a high level? Some things that are becoming more common, or is it unique every time?
I think, well, there's some uniqueness to it. I think if I were to have to generalize, it's people don't take into account the effects or the lack of hormones, contributing to the negativity in their life. And so, people who are high achievers, high performers, they tend to think that the way to fix any problem is to work harder, right? And you have to work harder by doing more, exercising more, sleeping less. And that's really not the way in. Like the wisdom is allowing it and then working with things to make it easier on yourself. To reduce that stress.
Yeah, your advice to me was actually like, do you have a fiction book or something you can wind down, or a prayer or a meditation? Like it was not like, hey, you got to go do more and more.
And that's hard for people who are high achievers because they feel like they're giving up, right? But they're not. It's just a shift, and that's what I think is the biggest thing. They don't understand that.
Meditation has single-handedly changed my life. I think to be introspective and think is the most powerful thing you can do, and it is hard to do. I started with 5 minutes.
That's great.
This morning I did 50.
Wow.
Yeah.
But that's over 8 months.
And I think people don't understand about meditation. You're not necessarily meditating for the meditation. You're meditating to put yourself in a mind state that you can handle the rest of the day and be peaceful, grounded, without, having to be worked up.
I don't know if I was peaceful and grounded on the elevator.
No.
It's interesting. A friend of ours in Hawaii, he made a comment that ties into Craig's previous statement. As high achievers, you just want to go, go, go. And nobody wants to, we want to be experts at everything. And this world is so stressful. But you really are looking for every opportunity in your life to surrender. That's essentially what what is the crux of it?
Yeah.
And
So you surrender to the skin expert. You surrender to people who know about vitamins or hormones. You surrender to all things in life. And if you can be open to that, then it gets, you're not going to be the expert on
We don't have
most
to be.
things. You can't
I
be.
totally agree with you. I think that is a fundamental part of success, is really being able to surrender, go inward, think, be quiet with your own thoughts. Michael and I were talking about with COVID, people either really valued their time to be introspective or they hated it. It's so weird because you go to like a party now and you can tell the people that hated it because they're like so excited to be there. Nothing wrong with that. But then there's the other people that I've noticed that I value my solitude 20,000 times more after COVID because I got that time and space to myself. So it's interesting how it went either way.
Sure.
You guys are amazing. Tell us where everyone can find you if they want to book you and how you would work with someone who's brand new on the podcast.
Go ahead.
They can reach out via Instagram. We have our website, our phone, our email, whatever. We generally start with a virtual consult. We have a telemedicine platform and we do a virtual consult to get to know them, understand their goals. It's better when we're face-to-face. A lot of them, most of them come to Charleston and they do a host of treatments. They'll stay, we're the #1 destination city, so people like coming there. I provide skincare stuff over the internet. Sometimes it's more of a situation where they need me to guide them to the best place to go in their town. They just can't physically travel for whatever reason. So I've built relationships with a lot of different people across the country that I can then refer them out to.
I want to come to Charleston. I want to come get the whole thing.
We have a trip
want
over
you
here. There's
to.
a bunch of people, including you guys, that we want to get out there. I mean, it's been a while since we've gone. We love
maybe
it out
me
there.
and Patricia from Southern
Perfect.
There
Charm
you
can
go.
come in and get treatments.
Perfect.
She has beautiful skin.
I know.
She stays out of the sun.
Exactly.
And how do they work with you?
Similar way.
Okay.
We want to get to know people. We're about building relationships. Part of it with us is we're growing because of what this venture with Soho House, and we're now in England, and then we'll be in Europe, and it's making sure that the client is a good fit for us because we're very busy, and not that we don't have room or want to. It's just we've got to meet each other where we are for it to be successful. So some of it is just kind of like, okay, are you sure you want to work with us? Because we have high expectations. Like we really want to get to know people and really want people to have access to all these different tools, but then we really want them dedicated on their end, working hard.
Why I'm so excited for you to be my doctor and Kelly, you to be my skin expert after this pregnancy is because I really respect your approach. It's a total 360 approach. You're not against one thing or another. You're open-minded about lots of different treatments. And I think that our audience is super savvy and a lot of overachievers. And I think that you guys are the perfect team for them.
Oh, well, thank you.
Thank you.
What about your Instagram? Where can everyone find you on Insta?
Koniver Wellness and Koniver Aesthetics.
Yeah, easy.
Yeah.
You guys are like the him and her of wellness.
Maybe. Yeah. I don't know.
Thank you guys for coming on.
Thank you for
Thank you so
having
much for
us.
having
Thank
us.
you.
Yeah, thank you.